Welcome. In this video, we'll talk about two important conditions, lumbar spinal stenosis and cardiac amyloidosis. Don't worry if you've never heard of these terms before. We'll explain everything in a way that everyone can understand, so let's get started. First, let's talk about amyloidosis. It's a group of diseases where misfolded proteins build up in different parts of our body, like organs, joints, or ligaments. These proteins, called amyloid fibrils, can interfere with how our organs work, including our heart. Now, the most common protein that causes trouble in our heart is called transthyretin. Picture it like a four-leaf clover. It transports and delivers important things like vitamin A and thyroid hormone to different parts of our body. That's why it's called transthyretin. Now, as we age, this protein becomes unstable, changing shape and forming amyloid fibrils. It's important to note that certain variants in the TTR gene can contribute to this process, increasing the likelihood of amyloidosis. When transthyretin deposits in the heart as amyloid fibrils, it makes the heart muscle thick and leathery, resulting in a condition known as transthyretin amyloid cardiomyopathy. Symptoms include shortness of breath, decreased exercise tolerance, swelling, and sometimes abnormal heart rhythms. If left untreated, this condition can be fatal. But here's the good news. We have effective treatments for transthyretin cardiac amyloidosis. These treatments can either stabilize the protein to prevent it from falling apart or stop the body from making it. The earlier we start these therapies, the better the results. Interestingly, many patients with transthyretin cardiac amyloidosis experience orthopedic issues before heart problems arise. These issues can include carpal tunnel syndrome, joint replacements, tendon tears, and even lumbar or cervical spinal stenosis. If you had lumbar spinal stenosis surgery, listen up. We've discovered that up to 1 in 3 patients who've had this surgery also have amyloid deposits in the spinal tissue that was removed. We can examine this tissue at no cost to you, thanks to support of the National Institute of Health. Now, why is this so important? Amyloid in the spinal tissue can be a sign that amyloidosis might develop in your heart. If we find it in your spine, we'd like to invite you to a clinic visit for further cardiac testing. During this visit, you would receive an EKG, which checks the electrical activity of your heart, an echocardiogram or ultrasound of your heart, and a specialized scan to detect any amyloid in your heart. All of this testing would be completely free of charge. If amyloid's found in your heart, don't worry. We would refer you to a specialist who can prescribe appropriate therapy for cardiac amyloidosis. Catching this condition early and starting treatment is crucial to prevent complications. To summarize, we have an amazing opportunity to use our growing knowledge of the link between amyloid in the spine and amyloid in the heart to identify potentially life-threatening conditions early. By providing early therapy, we can prevent the negative effects of this condition. It's an opportunity to safeguard your heart health and receive necessary treatment. Remember, it won't cost you anything. Thank you for your time, and let's work together to ensure a healthy heart and a brighter future.